Today I will be doing my trauma assessment patient on this stuffed animal monkey. I will be reenacting like the monkey getting shot in the head with this, and then he'll be my trauma patient. He'll be a 33-year-old male found on the sidewalk, and yeah, I'm gonna pretend to shoot him, and he'll have the head injury, and then I'll come in as a EMR and respond to the scene.
Hello? Hello? Boom!
So now, make sure proper BSI, gloves, scene is safe, mechanism of injury. I see that there's a 33-year-old white male with a shot wound to the head. Number of patients, 1, and I would call for an additional resource so we can transfer him immediately, as this is a shot wound to the head and this could be very critical. I would consider a C-spine if needed, and yeah, here we go. We have a white male on the sidewalk, shot wound to the head, lots of bleeding. See no other wounds right now. Come up to the patient. Hi, I'm Austyn Niesing. I'm an EMR licensed student from LTC. I'm here to help you today, sir. I would check to see if he's alert, so I would see his attention. As I come up on him, I see that his eyes are open. He is alert to me. He is talking a little, and he is not unresponsive. I checked his airway. That is patent also. What seems to anything else hurting around you besides your head, sir? And he says no. And then I move on to airway, and I check his airway. Obviously, it is not patent. He's talking. He is responsive. So I check circulation. I check his pulse. I check everything else, see how that is. And then I check his breathing. I check his rate, depth, and quality of the breathing. So I'm going to check his chest, look at that, see how good his chest is rising and falling, check his pulse, check for sounds, like if there's wheezing or anything, or if he's having a little bit trouble with breathing, because I know that head wound can be very critical and can make the brain cause so many different things. Now, circulation, any external bleeding. Obviously, we have a head wound, so there's going to be bleeding, lots of bleeding. We obviously already said that. This will have to be controlled, so right away I'm going to put a pad on it as I see that, as I walk up onto the scene. And I'm going to compress onto that wound so the bleeding stops. I will then wrap that as needed. So I move on to decision time, and I would treat this patient in the red zone and the yellow zone and get him immediately cared to the hospital, so that way he still is able to function well with that bullet still in his head. Then I'm going to expose of his full body, so pretend these are his clothes, ripping them all off. I'm checking to see if he has any more injuries besides the head, any more maybe possible gun wounds. I find that he has a couple scrapes on his knees from falling maybe, but that's it. No other wounds besides the head. Fast exam, I would be looking up and down the patient, making sure that he has no other wounds. I make sure back too. And all I see is that we have a shot wound to the head, nothing else. As I said, couple scrapes on the knees from falling, probably. Yeah. And then I would move on to my vital signs, and if I have another coworker or another person with me, he could already have gotten the vitals. But I would get vitals as needed. I would check for the skin color, see if there's any discolored in the skin, because maybe he could be going unresponsive pretty soon. I would also check his pulse. I would check his blood pressure. I would check his pupils. I would check his respiratory rate, his breathing, everything else. I would check his pulse oximeter. I would check for the EKG and the glucometer. Forgot what that's called. And yeah. Then I would move on to history, and I would ask the patient, as he is responsive, onset description. I would ask him, do you remember how this happened, sir? Let's say he responds, no, I do not, but I remember a little bit of what the guy looks like. So he gives us a little detail of what the guy looks like, helps out the police, and then I move on to provocation palpation, and I got that, and then I got the quality. I ask him how, I look at it, how deep is it? Then I ask him, on a rate of 1 to 10, how bad does this hurt? And he says, oh, about an 8 or 9. I said, okay. Then I'm looking for the region and asking him where it hurts the most. I'd feel around, feel the tenderness. See where it hurts the most, see what I gotta do to make sure that wound stays shut. So that way, when he gets to the hospital, they can do whatever they need to make sure it's completely shut. Then, I would ask for the severity. I would also ask one more time, how bad is it, a scale 1 to 10, how bad does this hurt? Obviously, he's in a lot of pain. Obviously, he's going to really be hurting. But you want to make sure you feel, so you know, like, maybe where the bullet is inside the patient's head. Maybe it could be close, so you could pull it out. Or maybe it could be far in there. You just want to feel to make sure that it is, like, maybe easy to pull out. Or if it's, like, in there to where you have to transfer the patient immediately. Then I would ask, when did this occur? Do you remember when this occurred, sir? He goes, about probably 20, 30 minutes ago. Then I asked for any follow-up questions. I asked, I could ask, like, sorry, I don't remember a follow-up question. But I could ask, like, where were you walking to? Was this an argument, or like what led to this? I could ask something like that. I'm sorry, I couldn't figure something out. Then I would move on to sample. I'd look for signs and symptoms. I'd see that he's very responsive. I see that he has no symptoms from anything besides he's having a little trouble breathing. He's going in and out of consciousness a little. He's unresponsive, might be going unresponsive soon, but all we know is he was responsive right now. I ask, with all the things he can, like, with as much as he can to talk to me, I'm gonna ask, do you have any allergies to anything? And that's where he says no. Do you take any medications at the moment? He goes, no. Then I would ask, do you have any past medical history with any shot wounds before that I do not know about? Like, have you experienced a shot wound before besides one in the head? He goes, yes, I've been shot before, but not in the head. And I go, okay, where is that? He goes, I got one in my leg and one in my arm. I go, okay. First time that happened, did this feel anything like it? And the second time that happened, did this feel anything like it? And he goes, no, this feels way worse. So I go, okay. That makes my life a little more easier, my job a little more easier. So now I know that this is a very bad issue for him. This is to the brain, this is to the head, to the skull, and this is very worse than his last 2 shot wounds. So I'm going to assess very quickly. I'm going to make sure that patch is on there, like I said in the beginning. I'm going to wrap his head, make sure that Patch stays on there, that wound stays sealed until proper care can be needed at the hospital. I will do my in-depth physical exam. We can tell that he is responsive. We can tell that there's just a wound to the head, and yeah. Then I look and see that body systems, his respiratory is a little off. His breathing is a little off, but we got a shot wound to the head. His chest is, like I said, he's a little bit like not able to breathe, little trouble breathing. Then I would focus mainly on his breathing. I would focus on his responsiveness and on his head, and making sure that head wound stays sealed, like I said, until proper care is needed. I would make sure that his breathing stays accurate. Keep checking his pulse. Keep going back, making sure he stays responsive and does not go unresponsive, as you can lose a lot of bleeding from the head with a shot wound. And then we would move on to the jump bag. If you have your partner, the jump bag will already be out, or possibly you have to go get the jump bag. Get the jump bag just in case needed to do CPR or anything else, just in case he does go unresponsive. Then I would, as I get the patient ready for transport, I have this patch on his head, making sure the wound is sealed, checking his rate and depth and quality of breathing, checking for airway, checking for circulation, asking again, does this hurt when I touch around it? Asking, are you having any trouble breathing, sir? Can you still respond to me? Can you wiggle your fingers? Can you feel me touching you? And he says yes. So I'm going to check for his responsiveness and the AVPU again. And then I'm going to reassess again. I'm going to do everything over. I'm going to make sure, keep going over like pulse, keep going over, does this hurt? Asking him how bad it hurts, and making sure his eyes are open, checking AVPU over and over and over again. And once the other personnel get to the scene, I'm going to transfer my info to them before I leave my scene. I'm going to write up a write-up scene. And if I have to go in the ambulance, I'm going to make sure I keep reassessing on my patient, making sure I ask him questions, making sure he's still alert, making sure he's still verbalizing, and he's not going unresponsive. And as this patient is getting rushed to the hospital, he is getting his wound healed. They're making sure they get proper care to this wound, and that he's good to go to leave the hospital, and that he does not die. This is my patient, shot wound to the head. I'm done here.